It's been a bad season already for illnesses from the flu to stomach bugs. And today we're joined by a doctor who sees it all from patients young to old. We're joined by Dr. Thomas Eppes with Central Virginia Family Physicians. Thanks so much for joining us today.
My pleasure.
Now, it might be me because I have a 5-year-old and a 16-year-old, but it seems like everybody's sick all the time. Is this winter any different?
This winter, as far as the flu goes, has been pretty mild.
Really?
And a big part of that is because the public health department and the school systems have worked very hard to immunize children, which is the source of most flu epidemics. But all winters, because people are close together, they spread illnesses easily. So we see a garden variety of things, whether it be stomach viruses and vomiting and diarrhea, or
Lovely.
bronchitis that just sits there and doesn't go away.
And let's talk a little bit about where you work, Central Virginia Family Physicians. You guys see people young to old, right?
Cradle to grave. I always tell one of my best experiences, I checked a newborn in one day and did a house call on a guy 115 that night.
Neat.
And that just epitomizes the range of what family physicians do. We take care of pediatrics, elderly, and everything in between, as well as injuries, just a garden variety of everything that can happen to a person in their healthcare years.
And the healthcare system itself, the landscape is really changing right now, isn't it?
It's going to, we're moving away from being a volume-driven business to population management. And that's a challenge for physicians because you were trained one way and now we're moving to team care. And that our group is very active in not only pulling in the electronics of everything so that you can do that, so you can mine the information to see that you're really doing what you say you do, to building teams with your nurses, your medical assistants, nurse practitioners, PAs, to pull in everybody. There are just not enough physicians in the United States to take care of all the people that need care, and so this model is one way of doing it. The director of healthcare for IBM, Paul Grundy, will tell you that if a patient one of his employees can identify their primary care physician, their healthcare cost is about 1/3 of people that can't.
Interesting.
And that's because he's a huge proponent of what's called the patient-centered medical home. In the future, physicians, which always have been open 9 to 5 and close the doors, and we got to look at ways that we can actually extend to people where they want their health care, where we can answer questions online so they don't have to come in.
That's nice.
And so that little question that you feel like, gosh, I just wasted that office visit because he didn't give me the magic piece of paper that was an antibiotic, that they really didn't need to come in the first place. Or that you can manage their diabetes at night or in the afternoon by just giving instructions about how to change doses of medicines or change blood pressure medicines without having to see them repetitively. But that's the
fantastic
type of
idea.
But the idea is being able to help people take care of themselves, engage them in their health care as we build a team that will help them do that. That also includes the people that don't want to be taken care of. And so we have a position called a nurse navigator now that will take on the really tough people.
Wow.
That you call them up at home. Have you done this? Have you sought out this solution to your problems to get them to change behaviors so we end up with a better, healthier population?
And fortunately, we're going to be talking to you guys for several times over the next few months, so we'll get more information for you. Let's get your graphic up there. Central Virginia Family Physicians, if you'd like to learn more, 434-382-1125 or online at cvfp.net. And thanks so much for joining us.